Hi, I'm Michael Lightman, Chief of General Surgery at Beth Israel Medical Center in New York. I'm going to speak to you about gastroesophageal reflux disease, or GERD. Gastroesophageal reflux disease is a common condition in which the stomach contents, either food or liquid, leak backwards from the stomach into the esophagus. This action can irritate the esophagus, causing heartburn and other symptoms. When you eat, food passes from the throat to the stomach through the esophagus. Once food is in the stomach, a valve comprised of a ring of muscle fibers prevents food from moving backwards into the esophagus. These muscle fibers are called the lower esophageal sphincter, and it acts like a valve. If this sphincter muscle doesn't close well, food, liquid, and stomach acid can leak back into the esophagus, and this is called reflux, or gastroesophageal reflux. Reflux may cause symptoms, or it can even cause damage to the esophagus. The risk factors for reflux include alcohol, hiatal hernia, which is a condition in which part of the stomach moves above the diaphragm. The diaphragm is a muscle that separates the chest and abdominal cavities. Other risk factors include obesity, pregnancy, connective tissue diseases such as scleroderma, smoking, and other conditions. Heartburn and gastroesophageal reflux can be brought on or made worse by pregnancy and many different medications. Such drugs include anticholinergics, typically used for seasickness, beta blockers for high blood pressure or heart disease, bronchodilators for asthma, calcium channel blockers for high blood pressure, dopamine active drugs for Parkinson's disease, progestin for abnormal menstrual bleeding or birth control, sedatives for insomnia or anxiety, and tricyclic antidepressants. If you suspect one of your medications may be causing heartburn, speak with your doctor. Never change or stop a medication you take regularly without speaking with your doctor. More common symptoms include feeling that food is stuck behind the breastbone, heartburn or a burning pain in the chest area, again underneath the breastbone, increasing by bending, stooping, lying down, or eating, more likely worse at night, relieved by antacids, and nausea after eating. Less common symptoms include regurgitation of food, cough or wheezing, difficulty swallowing, hiccups, hoarseness or change in voice, or sore throat. You may not need any tests if your symptoms are not severe. However, if your symptoms are severe or they come back after you've been treated, one or more tests may help diagnose reflux or any complications of reflux disease. Such tests include upper GI endoscopy, which is often used to find the cause and examine the esophagus. The doctor inserts a thin tube with a camera on the end through your mouth. The tube is then passed into your esophagus, stomach, and small intestine. Other tests include upper GI barium x-rays, continuous esophageal pH monitoring, and esophageal manometry. Your physician may also order a stool blood test for occult blood, which may diagnose bleeding that is coming from the irritation in the esophagus, stomach, or the intestines. You can make many lifestyle changes to help treat your symptoms. Avoid foods that cause problems for you. Making changes to your routine before you go to sleep may also help. Avoiding drugs such as aspirin, ibuprofen, either Advil or Motrin, or naproxen, such as Aleve or Naprosyn. You should consider taking Tylenol or acetaminophen to relieve pain. Take your medicines with plenty of water, and when your doctor gives you a new medicine, remember to ask whether it will make your heartburn worse. You may use over-the-counter antacids after meals and at bedtime, although they do not last very long. Common side effects of antacids include diarrhea or constipation. Other over-the-counter prescription drugs can also treat gastroesophageal reflux disease. They work more slowly than antacids, but give you longer relief. Your pharmacist, doctor, or nurse can tell you how to take these medications. They include proton pump inhibitors, or PPIs, and they decrease the amount of acid produced in your stomach. Other medications, such as H2 blockers or antagonists, Also lower the amount of acid released in your stomach. Anti-reflux operation such as fundoplications and other procedures may be an option for patients whose symptoms do not go away with medications or lifestyle changes. Only 1 to 2% of patients with heartburn will ever require surgery. Heartburn and other symptoms should improve after surgery, but some patients may need to continue to take drugs for their heartburn symptoms. There are new therapies for reflux that can be performed through an endoscope without any cutting at all. Most people respond to lifestyle changes and medications. However, many patients may need to continue taking their drugs to control their symptoms for long periods of time. There are certain complications that occur in patients with gastroesophageal reflux disease. Some rare complications from reflux include asthma, Barrett's esophagus, which is a change in the lining of the esophagus that can lead to an increased risk of cancer of the esophagus, bronchospasm, which is irritation and spasm of the airways due to acid, chronic cough or hoarseness, dental problems, esophageal ulcer, stricture, which is a narrowing of the esophagus due to scarring. If any of these situations occur, call your health provider, especially if these symptoms worsen or do not improve with lifestyle changes or medications. Also remember to call for any of the following symptoms: bleeding, choking, feeling filled up very quickly when eating, frequent vomiting, hoarseness, loss of appetite, trouble swallowing or pain with swallowing, and weight loss. At Beth Israel Medical Center, we have many fine specialists that treat patients with gastroesophageal reflux disease. Many of our experts are able to treat patients with medication, and our surgeons are able to provide the latest and most up-to-date treatments for patients who require operations for their problem.